Caregivers are often overwhelmed by the number of new skills they must learn, and often they must learn these skills by trial and error. But more experienced caregivers and health professionals have already developed these skills, and by tapping into their store of knowledge, your role as a caregiver will become easier and more beneficial for you and your loved one. Helping your loved one with hygiene is a large part of caregiving. Bathing is often the major activity in the patient's daily routine. People generally feel better after a bath or shower, and it provides exercise, which stimulates circulation. A bath is also a good time for you to check the patient from head to foot for any changes that should be reported to the doctor or nurse. Helping your loved one with the highly intimate task of personal hygiene may be difficult and uncomfortable for both of you in the beginning. You may initially feel embarrassed. You may feel frightened, sad, angry, or confused to see a parent or other loved one in such a dependent position. And the person receiving care may have similar emotions. These are all common feelings, and in time, they will be overcome.
Sometimes we have a son who's taking care of a mama, and he's doing an excellent job, but he can't change mama. He cannot give mama a bath. There are some female caregivers who are taking care of males, but sometimes it's very difficult for that father to let that daughter bathe him. And those are issues that, sometimes families can get past them, and sometimes they can't. And if that's a problem, find a way, to get around that issue.
Encourage your loved one to do as much as possible to meet their own hygiene needs, even if they prefer to remain more passive. Encouraging a more active role gives your loved one a sense of independence and dignity, and it also saves your time and energy.
I have liquid soap, and I put the liquid soap on the washcloth, and he scrubs himself. And he gets clean. But I want him to do as much for himself as he can. I don't want to take all of his freedom away from him or his rights, what things that he should be doing.
Some patients will need a complete bath while in bed, either on a temporary or ongoing basis.
Older people do not need to be bathed as often as we once thought they did. And so a lot of people enter into that thinking, oh, mother has to have a bed bath every day, or daddy has to have a shower every day or something like that. Well, that's not true. And in fact, that's probably detrimental to the skin conditions, particularly of an elderly person.
Some days you may only need to bathe the patient's face and any soiled areas. However, mouth care should be performed every day. Remember, hygiene is an aspect of caregiving where you should be flexible in your expectations and approach. As you gain experience and practice, you'll develop your own ways of doing things as you discover what works best for you and the patient. In some cases, you may only need to bring the necessary items to the bedside and leave the patient alone to bathe. However, most patients on total bed rest will need help. A home health care nurse may be able to help you bathe your loved one. Ask about this possibility. It does help, though, to learn the basic principles and steps involved. There are 4 fundamental guidelines to follow when giving someone a bed bath. First, make the bath a comforting experience for the patient without overtiring yourself. Second, always begin bathing the cleanest areas first and leave the dirtiest areas for last. Be sure to change the water and washcloth after cleaning any areas that might contaminate or reinfect the patient. The third guideline is to use the bath to stimulate the patient's circulation and promote exercise and activity. The bath may be the primary physical activity for a bedridden patient. To promote circulation, the caregiver should wash in long, smooth strokes. Don't massage the patient's calves, however, because this can dislodge blood clots that are more likely to form in bedridden or very ill patients. Finally, observe the patient for any changes that need to be reported to the nurse or doctor. This includes how the patient seems to feel, especially if they can't communicate clearly. Now that we've reviewed the basic guidelines for giving a bath, let's go over the step-by-step process. If at all possible, bathe the patient near a sink. Fill the basin halfway with warm water that feels slightly hot to the touch, about 120 degrees Fahrenheit. The water will cool to a comfortable temperature of 110 to 115 degrees by the time you're ready to use it. Also keep in mind the safety of you and your loved one during the bath. Assuming the patient is using a hospital bed, be sure to raise or lower the level of the bed to a position that's comfortable for you. This prevents strain on your back, arms, and legs. You'll also want to use the side rails to ensure the patient can't accidentally roll off the bed. Position the patient in bed in a semi-sitting position, either by raising the hospital bed to a 45-degree angle or propping the patient up with pillows or a foam wedge. Now, to make a bath mitt from a washcloth, place your hand in the center of the washcloth. Fold each side of the washcloth across the palm of the hand. Now, fold the top of the cloth over the palm and tuck it under the edge. Now you're ready to wash the face, starting with the eyes. Dip the washcloth into plain water without using soap, which can irritate the eyes. Clean the eyes by wiping from the inner corner to the outer area. Use a different part of the washcloth to clean each eye. Gently finish washing the rest of the face using plain water. Now it's time to use soap to wash the neck and behind the ears. Use bar or liquid soap to lather the washcloth, or add a no-rinse soap to the water. Do not leave the bar of soap in the basin, and don't put regular liquid soap in the water unless you use another basin of water for rinsing. If you use bar or liquid soap, be sure to rinse well. Then pat the washed areas dry with a towel. At this time, check the eyes for any sign of drainage or redness that may indicate irritation or infection. Check for yellow discoloration of the eye. Note any changes in the patient's ability to track your movements with their eyes. The pupils should generally be equal in size and react to bright light by becoming smaller. Notify the doctor or nurse immediately if the pupils do not react to light, or if one eye appears to be dilated and fixed in size. Also, any drainage from the ear should be reported. When washing the neck, look for changes in the size of the lymph nodes in the neck. Also notice the facial muscles. Does the patient move both sides of the face in an even way, or does one side droop? Begin the patient's mouth care by placing a towel across their chest. Wet the toothbrush and apply a small amount of toothpaste. Now gently brush the teeth, cleaning the upper and lower teeth and the tongue. After brushing, help the patient rinse using a glass of water and a small emesis basin. If the patient can swallow but has difficulty taking sips of water, squirt a little bit of water into the side of the mouth using a small plastic syringe without a needle attached, of course. Ask the patient to spit the water into the emesis basin. If the patient has a hard time swallowing, clean the teeth and tongue with a washcloth wrapped around your index finger. Wet the washcloth with clean water from the glass. Apply a small amount of toothpaste and clean the teeth and tongue. Remove the toothpaste and suds using the rinsed washcloth. Now use dental floss to clean between each tooth. Wrap the ends around the index fingers of each hand and gently work the floss between each tooth. Then ask the patient to rinse. If desired, you can also use a lemon glycerin swab or flavored toothette to give the mouth a pleasant taste. If the patient has dentures, remove the upper and lower plates and brush them using a stiff brush and toothpaste. A towel placed on the bottom of the sink will help protect the dentures if they're dropped. If the patient is going to sleep, soak the dentures overnight in a cleansing solution in a closed container. Rinse the patient's mouth while the dentures are out. Check for bleeding gums, broken or loosened teeth, sores, lumps, or white patches. Notice any change in the patient's ability to swallow or follow your directions. Shaving is also a part of regular hygiene for both men and women. To prevent cuts or electrical hazards, use a battery-operated electric razor and follow the manufacturer's instructions. Begin the rest of the bath by lowering the head of the bed or repositioning the patient comfortably. Unfasten the patient's gown so it's ready to be removed. Next, cover the patient with a top sheet and a clean cotton bath blanket. Reach under the bath blanket and pull out the top sheet so the patient is covered only by the bath blanket. While holding up the bath blanket as a drape to avoid exposing the patient, the caregiver can remove the patient's gown. Place the wash basin on a towel on the bed and dip the patient's hand in the water. Use the washcloth to wash the hand closest to you. Make sure you clean between the fingers and under the fingernails. Using long, smooth strokes, wash from the wrist to the upper arm. Rinse and pat dry the patient's arms and hands. Repeat the same procedure to clean the opposite hand and arm. Apply lotion to each hand and massage with short upward strokes starting at the fingertips. Stroke each hand several times from the fingers to the wrist. Then massage the arms with long, smooth strokes extending from the hand to the top of the arm. Remove any excess lotion with a towel or tissue. Afterwards, apply deodorant. Note any stiffness, limitation in movement, or pain in the arm. Also note any change in the way the patient holds their hand, especially if it's difficult to extend the fingers or if the patient forms a permanent fist with the thumb tucked across the palm. Check the elbows and arms for any redness or sores. Check under the arms for hard lumps, rashes, or redness. Now it's time to change the bath water and washcloth. Fold down the bath blanket and wash the chest and stomach. Carefully clean the patient's navel. If necessary, rinse the chest and stomach with a washcloth. Then dry the areas well and apply lotion to the skin. Now cover the chest and stomach with the bath towel initially used to drape these areas. Observe the skin for any discoloration, redness, sores, or rashes. Also observe whether the patient is breathing evenly and quietly. Check to see if the patient's stomach seems swollen or painful to touch. Report any changes to the nurse or doctor. Now check the color of the patient's lips and fingernails. A bluish discoloration may indicate the patient is not getting enough oxygen. Some patients, however, develop a bluish color when they're chilled, so after the bath, check to see if the color change persists once the patient's body temperature is warmed with blankets. Next, place a towel lengthwise underneath the patient's leg. Then bend the patient's leg on the bed and place the foot in the wash basin. Wash the leg from the hip to the foot using long, smooth strokes. Then wash the foot, paying particular attention to the toes and heel. Rinse, then pat the leg dry with a towel. After rinsing and drying, apply a small amount of lotion while supporting the foot in the palm of your hand. Use the thumb of the other hand to massage the sole of the foot. Then start at the top of the foot and massage in small circular motions across and then up each side of the foot. Now it's time to change the water and washcloth and repeat the same steps with the other leg. Be sure to notice any limitation in the movement of the leg or any sign of pain. Check the calves for any signs of swelling, redness, or pain and report these signs to the doctor or nurse. Be gentle when washing or applying lotion to the calves to avoid dislodging any blood clots that may have formed. Check with your physician about the extent of your patient's risk. For the next part of the bath, help the patient onto their side facing away from you. Make sure the opposite side rail is raised and place a towel along the patient's back, tucking it just under their side to protect the bed from getting wet. Now wash the patient's back, working from the shoulders to the lower back and thighs. Then thoroughly rinse and dry all areas. Check the skin for any sign of irritation, color change, or sores. A reddened patch over a bony prominence, such as a hip bone, or a persistently pale area may indicate the beginning stages of pressure ulcers or bed sores. Report any sign of a pressure ulcer to your doctor immediately. Now you're ready to give a back massage. Massage toward the shoulders with long, smooth strokes. Massage the muscles along the side of the spine with gentle circular motions. Note any areas that are tender to touch, especially in the lower back. The last part of the bath involves washing the patient's private areas.
We're almost done. Got one part left, and of course that's your private area. Let me tell you how I need for you to do it since you're able to. If you weren't able to, then I would do this part for you, but this is how we'll do it. I've got fresh water over here. Okay. And what I'm going to do is just take this towel, and I'm going to dip both ends in the water. Now, but I'm going to put soap on one end and leave the other one. So we're going to have a washing end and a rinsing end. Okay, I'm going to put soap on this end. Get it all lathered for you. Okay, then what you're going to do is you're going to take the soapy end, clean up over the top, down the side, and up underneath yourself. And when you're finished with that, you're going to use all the very same motions with this, with the rinsing end. And then the middle we've kept dry, and then you're just going to pat dry. If this were a female patient, the thing that you would do differently is this. You would go ahead and wet both ends, as you did before, soap up one end, and then you'd start on one side, taking one swipe down, one motion, being very careful that when you get ready to take the next one, you use a different part of your towel. Down the center, again repeat using a different part, and then do the other side. It's very important to use a different part of the towel each time, or else you may introduce infection. Go to the other end to rinse, and you're going to repeat the very same thing. Swipe down one side, different part of the towel, swipe down the center, another part, swipe on the other side. Take your dry area in the middle of the towel and pat dry.
On some days, the bath will be followed by washing the patient's hair, but hair doesn't need to be shampooed every day unless it's very oily or uncomfortable. To give a wet shampoo, position the patient on their back with a towel under their head to protect the bed. Place the shampoo basin or inflatable sink under the patient's head. Using a pitcher, completely wet the patient's hair. Use warm water ranging from 105 to 110 degrees Fahrenheit. Massage the scalp and the back of the upper neck gently with circular motions. Check for painful areas, knots, or swelling. Now rinse using warm water from the pitcher. Blot the hair with a towel to absorb any excess water, and raise the patient to a comfortable position while you dry the hair with a towel or blow dryer. Once the hair is dry, you can style it according to the patient's preferences. If you don't have a shampoo basin or inflatable sink, you can make one. To fashion a simple device out of basic household items, you'll need a large plastic trash bag, a sheet or bath blanket, a large plastic bucket, and some towels. Roll the sheet or bath blanket into a U shape and place it in a large plastic bag. Place the bag under the patient's head with the U-shape turned on its side. The open side of the bag will drain the water into the bucket on the floor. After the bath is a good time to perform nail care, usually on a weekly basis. Apply moisturizer or oil into the cuticles. While the cuticles are softening, clean under the fingernails using the pointed end of an orange stick. Massage the softened cuticles to help loosen them. Then, using the orange stick or a cotton swab, gently push back the cuticles. Don't poke the cuticles or break the skin. Then go ahead and trim or file the fingernail along the natural curve of the nail. Be careful not to cause any cuts or abrasions that could lead to infection. Regarding foot care, always check with the physician before working on a patient who has diabetes or poor circulation to the legs. A professional should provide foot care in this instance or teach you how to do it. When you're finished with all the patient's hygiene care, remove soiled linens and other items and disinfect the bath basin with hot, sudsy water and a germicidal solution. The bedridden patient requires special care and creativity to make life as normal as possible. Look for ways to help the person maintain a sense of meaning, dignity, and independence. You may also want to consider special medical equipment and accessories to provide more comfort and support. For example, an adjustable hospital bed may be the best choice for bedridden patients, and it helps prevent back strain for caregivers. Select bedding that is lightweight, soft, and washable. Synthetic fabrics are often too hot and don't absorb perspiration. Always have several sets of bedding changes on hand to be ready for unexpected circumstances. However, a complete bed change shouldn't be necessary every day as long as you protect the bottom sheet with a disposable pad or draw sheet. If the patient is not able to get out of the bed, change the linens while the bed is still occupied. Always explain to the patient what you're going to do in advance, even if they seem unresponsive. Before you start to change the linens, make sure the bed is at a comfortable height and the rail opposite of you is raised. Lower the head and foot of the bed to a flat position, then apply plastic gloves for protection. Now remove the pillows. The patient should remain covered by a sheet for privacy and warmth. Help the patient move to the opposite side of the bed. Starting at the head of the bed, strip the bottom sheet, draw sheet, and linen-saving pad from the unoccupied side of the bed. Roll the sheet tightly against the person's back or side. Remove your gloves before touching the clean sheets. Now slip the clean fitted bottom sheet over the top and bottom corners of the mattress. Fan fold or roll the rest of the sheet next to the patient's back or side. Then place the draw sheet in the middle of the bed. Tuck the edges of the sheet tightly under the mattress. Fan fold or roll the rest of the draw sheet next to the patient. If needed, place a linen-saving pad in the center of the bed and tuck it under the patient's back or side. Now that you've completed this side of the bed change, raise the side rail. Move to the opposite side of the bed and lower the side rail. Put on another pair of gloves and loosen the soiled linens. Help the patient roll onto the clean side of the bed and remove the soiled linens. Remove your gloves once again and pull the folded bottom sheet, draw sheet, and linen-saving pad toward you. Place the fitted bottom sheet over the top and bottom corners of the mattress. Pull the draw sheet tightly toward you and tuck it under the mattress. Help the patient onto their back if necessary. Center a clean top sheet, hem side up, over the used sheet, while you pull out the used sheet at the foot of the bed. Place the blanket on top of the clean sheet. Fold the top of the sheet over the blanket. Complete the job by changing the pillowcases. After changing the linens, help the patient into a comfortable position. There are two positions a patient can use, the back-lying or supine position or a side position. If the patient needs help moving onto their side, tuck one or two pillows lengthwise under their back to provide support. The pillows are necessary to position the patient in a way that prevents muscle strain and fatigue. Place a pillow lengthwise between the patient's legs to relieve pressure on the inner legs and thighs. Next, place a pillow lengthwise under the patient's upper arm to prevent the shoulder from dropping forward onto the bed. To position the patient on their back, raise the head of the bed to a comfortable height. If the bed is not adjustable, you can purchase an adjustable backrest. Next, place a pillow lengthwise under each arm for support. If necessary, you may want to use a footboard or high-top tennis shoes to keep the patient's feet in correct alignment. Mealtime is often the highlight of the day for a bedridden person. To promote independence, encourage the patient to help select the menu. Unless the physician advises otherwise, raise the patient to a sitting position to eat. A hospital-type overbed table can be used to serve meals. You can make your own overbed table by covering a wooden board with vinyl shelf paper or wallpaper. Place a straight-backed chair on each side of the bed and lay the covered board across the chair backs. If the patient has difficulty using utensils, Serve finger foods such as small sandwiches, soft vegetables, fruits, cheese, and meats. Always encourage the patient to feed themselves. If you're concerned about spills, cover the patient with a plastic cape or water-resistant gown. A straw or spill-proof cup and a plate with a non-skid mat underneath can help prevent accidents. With the bedridden patient, it's also essential to provide a regular routine. Most patients do best when they have a set time for bathing, meals, activity, and rest. It's also important to maintain natural cycles of light and dark in the patient's room. Open the curtains or blinds in the morning. The bedridden patient should, if at all possible, be placed near a window with a view. Also place a large calendar and clock in the room. Encourage or help your loved one to keep a personal calendar marking special events or activities they can look forward to. Special events and surprises are also important to break up the daily routine. These don't have to be elaborate. You can wrap up a little gift, rent a movie, or schedule a visit with a special friend or relative. You should, of course, gear activities to the person's mental capabilities. Here are some tips to ensure a successful visit whenever company drops by. Start by paying attention to the patient's hygiene and grooming before the visit. Then prepare visitors in advance with ideas for conversation and activities, like a game of cards or board games, writing a letter together, or making a video or audio tape to share with others. You can also help the bedridden patient maintain meaningful involvement with the family. Your loved one may still be able to do small chores like folding laundry or helping children with homework or other interests. As patients become more frail or ill, they may naturally withdraw. One of your responsibilities is to encourage the patient to enjoy activities and social contact. You should, however, let them set their own pace. Last, but certainly not least, find ways to cut down on your workload. Organize the patient's room to prevent unnecessary steps. Then, organize a routine that gives you some free time while the patient enjoys solitary activities. Set limits on the number of trips you'll make to get things for the patient. Then ask the patient to consolidate requests for items that aren't essential. If the patient is making numerous requests, try to find out the underlying need. You may find the patient simply wants attention or diversionary activities due to loneliness, fear, or boredom. Mobility is a significant factor in your loved one's sense of independence and self-confidence. In turn, the more mobile your loved one, the less dependent they'll be on you, giving you more time to concentrate on other activities and responsibilities. Safety is your first concern when helping someone with mobility. A nurse or physical therapist can determine if you're physically able to help the patient by yourself. If not, special devices like a mechanical lift can relieve much of the physical burden. First, let's learn how to safely transfer a patient from the bed to a chair. In each step, tell the patient what you're going to do before you do it. Position the chair or wheelchair at an angle on the patient's strongest side, then lock the wheels of the chair. Next, remove the wheelchair's footsteps. If you use a stationary chair, make sure it's heavy enough to prevent sliding as the patient sits down. If you're using a hospital bed, lower the height of the bed and lock the wheels. Slowly raise the head of the bed to a sitting position. Help the patient toward the side of the bed nearest you. Have the patient hug you with their arms over your shoulders. Now hug the patient with your arms under the shoulders and around the back. While you're still in the hugging position, help the patient sit up and slide their legs off the bed. To prevent dizziness, allow the patient to sit for a few minutes to get accustomed to this new position. Now move the patient's feet slightly apart and rest the patient's hands on your shoulders. Straddle the patient's weaker leg with your own legs. Bend your knees using a wide stance for balance. On the count of 3, straighten your knees and help your loved one rise to a standing position. On another count of 3, Pivot the patient to the chair and use small shuffling steps while continuing to hug one another. If they're able to support themselves, ask the patient to place both hands on the arms of the chair for support. Make sure their hips are placed well back in the chair before lowering them to a sitting position. If the patient has difficulty sitting upright, you can use a special belt to secure the patient in the chair, or a special chair that has a table tray attached. Next, let's learn how to assist a patient who needs help with walking. Instead of transferring the patient to a chair, let them stand for a few minutes at the side of the bed with their hands on your shoulders for support. Normally, you'll walk on the patient's weaker or affected side, but if the patient tends to lean toward you, walk on their stronger side. Place your inside arm around the patient's waist, pulling them tightly toward you. The patient's arm should go around your waist, and you support the patient's hand with your outside arm. Do not allow the patient to put an arm around your shoulder, because if the patient should fall, it could pull you down too. Walk slowly, using small, even steps to match the patient's gait. An alternative method begins with you sliding your arm under the patient's arm. Firmly bring your forearm to your chest, drawing the patient to you. Hold the patient's inside hand with your outer hand. This position gives you good control of the patient. If they begin to fall, go down with them, controlling the speed and direction of the fall and paying particular attention to the patient's head. Do not try to keep the person lifted in the air using your back and arms. You may need help getting the patient up from the floor. Do not try to do this alone if the patient is not physically able to help, or if you suspect any injury to the patient.
If someone falls while they're at home, there are two things that are most important to look at. One, is there pain at the site of the fall? Is there any swelling? Before you move the individual, you would look at that and ask the person, do you have pain when you move that extremity? If there is that, then it would not be unacceptable to call the 911 to come and have the patient taken to the hospital for a check. If the person falls and gets up on their own, or can move to get up and does have some weight bearing, then it could be appropriate to wait. But again, I would also call the physician or call the nurse that's on call for the home health, or call that office and tell them what had occurred and find out whether they would want you to go to the emergency room at that time. I would not want someone to be able to pick them up, put them back in bed, and then find out the next morning that that leg has been broken or it's been swollen and they didn't feel any problem at that time. Most of the time this happens, it happens with people that have memory loss, Alzheimer's type dementia. They do not respond to the pain, or if they do respond to pain, they still think I should get up and walk.
Before examining how to enhance the patient's mobility through a regular exercise program, there are some things you need to consider for patients with limited mobility.
When someone's taking care of someone at home, the individuals at home usually stay in bed, or they have basically a bed to chair type of existence. That becomes a problem for individuals because they become immobile. And when they do become immobile, muscles can contract. Complications that can occur from that, serious ones, would be, for example, someone can get a blood clot in the lung called a pulmonary embolus. Normally when we walk, the muscles contract. That helps blood get up into our heart, and it pumps out through the lungs and around to our body again. When you don't have that, the heart has to work a little extra harder to do that. So some of the things that you could do is to help what's called maintenance range of motion, and having a routine daily of some form of what I call bed exercises, just simple movement of the arms back and forth.
Routine exercise stimulates circulation and keeps the joints and muscles in working order. Exercise also improves a person's mood, appetite, ability to sleep, and general sense of well-being. Even small tasks can be beneficial. For example, brushing the teeth or hair promotes range of motion. It's important to encourage the bedridden or wheelchair-bound patient to perform as many independent movements and exercises as they can, but always under the guidance of your doctor or physical therapist. Most of us begin each day by dressing. Even if we're not feeling our best, getting dressed each day and making every attempt to look our best gives us a feeling of self-worth. That's why, if your patient is able to get out of bed and get dressed, it's important to give them every opportunity to let them do that. As a caregiver, you may have to help your loved one with this essential task. A daily routine of grooming and dressing will improve the person's self-concept and self-confidence, as well as create a more normal lifestyle for daily activities within the household. But before you begin the daily task of dressing and clothing selection, there are 4 principles to keep in mind. Principle number 1, determine what the person is capable of doing independently, then encourage your loved one to do as much for themselves as possible. Typically, if the person can make basic decisions and complete simple tasks, they can probably dress themselves too, or with a little bit of help. Principle number 2, learn to work around any obstacles to independent or assisted dressing. You may need to communicate a clear and firm expectation that the person will get dressed each day. If the person has dementia, you may need to lay out the clothing one piece at a time in the order they'll put it on. This will help avoid confusion, like putting on underwear over top of slacks or shirts. If required, provide simple instructions for dressing. People with physical limitations may need some hands-on assistance or adaptive devices to dress, such as a button fastener. Principle number 3, keep safety in mind when selecting clothing and accessories. Make sure clothing is flame resistant, especially if the patient smokes. To prevent falls, select shoes with rubber or crepe soles. Slip-on shoes should fit snugly enough to prevent the patient from stepping out of them as they walk. If the shoes are a lace-up style, be sure they're securely tied with laces short enough to prevent the possibility of tripping. Principle number 4, always try to keep the person's dignity in mind. Some patients are too confused or immobile to help with their own dressing and grooming. If this is the case, provide a private area for dressing. Explain to the patient each step of what you're going to do beforehand. Take extra care when maneuvering limbs in and out of sleeves and pant legs. If the patient is immobile or has paralysis, be sure to support the extremities to avoid muscle strain or stress to joints and bones. For example, while putting on slacks, support the knees and ankles against the trunk of your body, then reach into the pants leg and slowly pull the leg through while you securely support each leg one at a time. The same rules apply while putting a shirt on a person with a paralyzed arm. Reach into the shirt sleeve, then slowly pull the patient's arm through the sleeve while you carefully support the arm. Another important guideline, respect the person's selection of clothing as long as it's safe and seasonal. Most importantly, remember that dressing should be a positive experience, not a battle. So if patients tend to choose clothing that doesn't match or coordinate, occasionally indulge them. Compromise and praise are 2 rules of thumb. Be generous with both. Express to your loved one how attractive they look after dressing and comment positively about their cooperative manner. These simple steps will help your loved one have a better sense of connection and stay actively involved in an essential daily routine. Experienced caregivers know the home setting can be a help or a hazard when dealing with patients who have physical or mental challenges. In this section, we'll talk about the various challenges in the home environment and provide guidelines and suggestions about how you might make your home safer and a more friendly environment for the patient. To get started, observe your home with a fresh eye for obvious dangers. Beginning at floor level, remove any throw or area rugs on hardwood or linoleum floors. They're prime candidates for tripping a foot or catching the leg of a cane or walker and causing a serious fall. Ideally, all floor coverings accessible to the patient should be on non-slip surfaces. Avoid carpeting with long pile or busy patterns that may give the illusion of movement. On wooden staircases, attach a non-slip surface on the outer edge of each step. Any sliding glass doors in the home should be clearly marked with masking tape or with decorative decals. Along these same lines, make sure upstairs windows are secured to prevent falls. In the bathroom, walk-in showers with wide entries provide the greatest accessibility for patients with limited mobility. For safety purposes, glass shower doors should be replaced with a shower curtain. Adhesive safety strips or non-slip bath mats should be positioned in the bottom of the bathtub or shower floor. You may also want to purchase a waterproof bench or chair to place in the shower or tub so the patient can sit while bathing. Whether your home has a shower or a tub, it's advisable to install a grab bar on the far side of the wall along with a telescoping or handheld shower nozzle, which allows the patient to easily rinse while seated. Other bathroom safety measures include installing a grab bar by the toilet and lowering the temperature on your water heater to 110 degrees Fahrenheit. That's to prevent scalding patients who have limited skin sensitivity. Lighting is another area of concern for those who are visually impaired by age or health issues. If your patient is visually impaired, they will see your home differently than you do. That's because they often experience the loss of visual detail or reduced sensitivity to color and brightness. To help remedy these situations, avoid fixtures with bare bulbs or tubes which create hot spots. Also avoid can-type down lights, which concentrate pools of light. Also install blinds or other coverings over windows to block glaring sunlight. Because visually impaired people may have difficulty distinguishing colors of similar intensity, try to use simple patterns and colors with high contrast. Individuals with hearing impairments often have difficulty recognizing high-pitched sounds, such as bells, sirens, or smoke and fire alarms. It is also harder for these individuals to distinguish between voices and competing noise or background music. Therefore, try to reduce sources of background noise like multiple televisions, radios, appliances, or loud clocks. Many elderly and ill patients can't tolerate extreme temperature changes. As a general rule, patients prefer extra warmth in the winter and are less tolerant of extreme heat during the summer. One word of caution: avoid drafts of air near the patient. It's not only a source of discomfort, but can also lead to health complications affecting the respiratory system, bones, joints, or muscles. Limited physical mobility is commonplace with ill and elderly patients. However, it's extremely important to encourage independence to enhance your loved one's self-esteem and sense of pride. So consider simple home adaptations. For example, you can install handrails along the halls and the walls of the rooms the patient uses most frequently. The top of the handrails should be placed at 33 to 36 inches from floor level. There should be no more than 1.5 inches of space between the handrail and the wall to prevent the patient from getting an arm stuck between the wall and the rail. To make grasping easier, replace round doorknobs with pull levers. You may also want to remove any interior door locks that could make it easy for your patient to get locked inside a room. If your loved one is disoriented or visually impaired, you should also poison-proof your home. Lock up medicines and other toxic substances that the person might ingest either accidentally or on purpose. The same holds true for knives, razors, scissors, and other sharp instruments. Whatever special needs your loved one requires, feel free to discuss these with healthcare providers. They can make suggestions to help both you and your loved one feel more comfortable and confident in your home environment.